In this myoskeletal video from my dynamic lower body e-learning course, I'm going to work on the Tensor Fascia Lata to try to relieve pressure on the IT band that is compressing that inflamed greater trochanteric bursa seen here. Also notice how the Gluteus medius muscle, that tendon there as it attaches adjacent to the trochanter, is also a little inflamed. But we're going to relieve pressure right now in the IT band, first by taking our fingers and palpating the greater trochanter so we don't put pressure on it. Then coming in front of the Tensor Fascia Lata, dragging it backwards just to warm it up a little bit. Let my body weight drop back as I pull that muscle back toward me just to warm it up. Now I'm going to come in with an elbow. I'm going to come at the origin of the TFL as it attaches to the ilium, and I'm going to put a constant pressure toward the table and toward the feet to try to drag it away from its firm attachment to get a good Golgi tendon organ release. To do that, I'm going to have Terry start to do slow pelvic tilts as an enhancer. So as she starts to slowly pelvic tilt, I'm going to keep constant pressure. Then I'm going to come above, palpate the greater trochanter, make sure I'm not on it, and now I'm going to come right on the TFL. Right there, we can see the TFL. I'm going to come right there where the pointer is pointing and push it down toward the table while she pelvic tilts. This really gives a nice graded exposure release on the IT track, allowing a little pressure to come off that inflamed greater trochanteric bursa. This is a fabulous technique for those people who are having lateral hip pain, greater trochanteric bursitis, gluteus medius, tendinosis, and greater trochanteric pain syndrome. Thank you.